Welcome. This is Dr. Andre Broussard speaking, and I want to welcome you to the prevention and recovery portion of my spine class. Through this experience, I hope that you gain the information necessary to help reduce the risk of injury, as well as learn how to promote your own recovery. In this video, we want to try to help you understand three basic things. The first are our goals of care. Usually there are three goals: symptom management, correction and rehabilitation of the underlying problems, and finally, preventive maintenance. Number two, we want you to understand that there are things you can do to help prevent injury and promote your recovery. And number three, that there are things you may want to stop doing to help to reduce the chances that you could be creating your own problems. The first goal of care is to help reduce any symptoms you may be experiencing. It seems that symptoms are a great motivator and cause people to go to the doctor to seek help. So the first thing we want to do is to help to alleviate your symptoms. After the initial symptoms, the best recommendation is to work on correcting what caused the symptoms in the first place. In most cases, I will suggest that we try to correct any structural issues if applicable. Posture is vital to health, and poor posture can become involved with musculoskeletal symptoms. Furthermore, when the body is out of alignment, it tends to wear out faster than necessary, much like your car tire treads wearing out when misaligned. Improved function is another goal for most people. Limited function and disability are very common problems that need to be addressed in most cases. I like to base my care plans on the objective functional findings, such as muscle strength, muscle endurance and coordination, etc., that we discover during the examination process. Another goal is to free the nervous system from interference. The nervous system, being the master control system, is in charge of most bodily functions. It is very important to reduce any tension or pressure on the nervous system in order for healing to occur, not only in pain syndromes, but as we'll see later, a host of other health issues and concerns. The long-term goal of care is to help you maintain all the benefits that you initially experience. This type of care is designed to help continuously improve your health potential as well as help prevent the recurrence of problems, and if they do, to significantly reduce the frequency and severity of them. Much like going to a dentist for oral hygiene, we are learning that spinal hygiene is important to overall health, and we can address this through appropriate care. Now, there are things you can do to help. First of all, don't test your adjustments. It seems that some people want to see if they feel better right away, and they want to test things out a bit. Please don't do this. We're trying to cause a change in the tissues, and they're going to want to go out all by themselves. They don't need any help. You don't have to be as stiff as a robot either, so the point is, just take it easy on yourself for a while. Don't poke or prod the area. Immediately after the adjustment, there is a latent period where if the area moves too much or too fast, the muscles will go into a protective spasm. We don't want that to happen to you, so please be careful to do your best and relax after your adjustments. Women, please try not to carry your purse over the shoulder. It is not necessarily the weight of the purse either. It's the fact that to keep the purse from falling off the shoulder, you will have to contract your shoulder and neck muscles. A strap that goes over the head, like in the picture on the bottom right side of this picture, is okay. Clutching and letting the purse hang are okay as well. Women, please try to avoid wearing high heels too often. This type of shoe is known for creating bunions, hammer toes, neuromas. They shorten the calf muscle. It increases the pelvic angle and increases the curve in the lower back, which can lead to lower back disorders. Men, try not to wear your wallet in the back hip pocket. When you sit down on your wallet, it causes the pelvis to shift, which puts a strain on the spine structures and can put undue pressure on the sciatic nerve as well. Everyone, try not to sit with your legs crossed. We usually form a habit of crossing one leg over the other, which tends to stretch one side of the hip and back muscles more than the other, and this can cause an imbalance that may create a problem or complicate an already existing one. Don't lay on the couch. Couches are supposed to be designed for sitting. If you lay around too much in the couch, especially with your head propped up on the armrest or a stack of pillows, this can cause problems as well. If you spend a lot of time on the phone, at home or at work, don't cradle the phone between your neck and shoulder. Get a headrest or a wireless earpiece to take the strain off of the neck and shoulder areas. Check your shoes and boots for breakdown. This woman was wondering why she could not get any better. Can you imagine trying to walk around in this pair of shoes all day? She was worn out by the end of the day. She had no energy left. Wonder why? If you have fallen arches, consider wearing arch supports. Foot problems can affect the structures of the body all the way up, like the domino effect. If you need help in this area, please ask. We offer professional, custom-fitted orthotics for the hard-to-manage cases as well. Keep your appointments. In order to get better, it is best to keep a regular schedule of visits. Much like exercising, if you want to improve your health or strength, you can't just exercise on January the 1st and expect to be in shape for the rest of the year. By keeping your appointments, you are laying the proper foundation for improvement. Now, let's move on and talk about prevention and how you can help reduce the risk of injury and reduce the strain on your body to help you get better quicker. When getting into and out of your vehicle, try to keep your shoulders in line with your hips. If you twisted the waist, you're putting yourself at greater risk while in this flexed and seated position. For overhead work, try to raise your body up to your project. The idea is not to work too long with your arms stretched above your head. When sitting up, try to sit with your knees below the level of your hips. When you recline, a position of about 135 degrees seems to take some of the stress off of the lower spine. My suggestion is to use some type of build-up in the back part of the chair that will tend to raise the hip joints higher than the knee joints. I have seen foam wedges like this at the Relax the Back store in the Kingsgate North shopping center here in Lubbock near the intersection of Quaker and 82nd Street. In the car or truck, try to position the seat where the arms are not extended too far. Try to get the seat back relatively straight up and down. Use your arm rests and make sure that everyone buckles up. If you sit all day at work, or if you study at school for long periods of time, try to vary your body position in the chair. Most of the time, it's not the chair that's so important, it's your ability to move around in the chair as to not put pressure on only one part of the body for extended periods of time. Take short, frequent micro breaks. If you've been seated for a long time, stand up. Relax your body for a few seconds. Then reach for the ceiling and take a big breath in and out. You can even bend backwards at the waist a little as well. You can alternate reaching up towards the ceiling with your arms, and you can windmill your arms. Either will do you some good. The hip hinge. Very important. This is a good way to practice the hip hinge movement. Get a mop or a broomstick and hold it as pictured. Hold it as you see in the picture and bend forward using your hips and knees. The stick will assure that you keep your head and back in the correct position, which will put you at a much lower risk of hurting yourself. We'll use this movement for a wide variety of daily activities. When you want to lift something, it's a good idea to pre-stress or pre-tighten your stomach muscles. It takes just a little effort to tighten your abdominal muscles, and it will tighten all around your back, like the metal straps that go around the wooden slats of a wine barrel. Let's look at right and wrong here. It is important to keep your spine upright by using the hip hinge that we described earlier. Even if the object is awkwardly placed so that it's not directly in front of you, the key is to keep your chest lifted in front while maintaining your lumbar spine's natural forward curve. Two other key points which will save you from irritating your back are to avoid lifting during the first half hour of the day and to avoid lifting immediately after sitting for a prolonged period of time, for example, over 40 minutes. Olympic weightlifters provide a convincing example of the efficacy of avoiding bending with their backs while they are lifting. They lock their spines and emphasize bending with their hips and not their backs. The golfer's lift may be more preferable for reducing spine loads than bending at the knees and keeping the back straight for someone repeatedly lifting light objects from the floor. As you can see, here are a few examples. Back pain is very, very complicated. Here are 3 important categories and some of the issues that we think contribute to back disorders. For instance, if we look under the individual heading, we will notice things like genetics, age, physical fitness, education, and emotional distress. Under the environmental heading, we see such things as lifting, bending, driving, etc. And under the psychological heading, we notice work stress and high job demands. All of these individual variables and combinations can affect us. In my practice, I see these factors as causative in many cases. Seated and or static work postures. People who sit for more than 5 hours a day, let's say, and people who work in bent positions for long periods of time are at risk for back disorders. Frequent or quick torso or upper body motions, frequent lifting, bending, pushing and pulling, vibration exposure, particularly seated whole body vibration, such as driving or operating heavy farm equipment, and the time of day. Make sure that you don't bend forward or lift anything first thing out of bed. And of course, being out of shape is another problem for a lot of people as well. These are some of the specific things we want to avoid if at all possible. This graphic represents where back pain occurs relative to our activity levels. We're looking at a U-shaped curve. In other words, on the left side of the scale, where total inactivity is, we see that there is increased risk of back pain. And on the right side, as we approach maximum activity, we see the graph goes up again, representing increased risk for back pain. We want to be right there in the middle somewhere, not too much, but enough activity to keep out of trouble. Sometimes things, can go without mentioning them, but I want to mention here that the better physical shape one is in, the more strain the tissues can take, and it puts us at a lower risk of injury. The more deconditioned or out of shape one is, the more risk of tissue failure and problems. What a lot of people don't realize is that most back injuries happen as a result of repetitious type loading and not necessarily trying to lift a very heavy load. For instance, Sitting for a long time is considered a repetitious type of loading. If you get up from that office chair to pick up a pencil after you've been sitting for 5 hours, you will have a good chance that you can injure your back. Try to remember that it's always better to push than to pull. Remember the old push me pull you? Push comes first. The expression, when push comes to shove, push comes first. So think of pushing objects before you pull. Make sure you test how heavy the load is and make sure that your path is clear. Keep your hands level with your lower back. Keep the back straight and tighten those abdominal muscles. When you begin pushing, push in a slow, easy manner, and when ready to stop pushing, ease up and finally return to the standing position. When you do pull, keep the load low. The picture all the way to the left shows a man pulling on a high load, putting himself at risk. The next picture shows the corrected position. The man opening the door by grabbing the handle low is at less risk than if he grabs the door way up high. If you have to perform repetitive pushing and pulling, as in vacuuming, sweeping, or mopping, try to put the load in front of your body. Holding the handle to the side creates large leverage forces on the lower back. By directing the forces right through the back, you're able to lower the leverage and put less stress on the spine. When lifting heavy objects, try to reduce the load. Some tasks can be performed by lifting only half of the object at a time. For instance, this girl lifts the log into the truck by lifting only half its weight at a time. First, she lifts one end onto the truck, then she lifts the other end and slides the log onto the bed. Each lift is half of the total load. For large, heavy, awkward loads, try to, quote, walk these large, heavy objects. Use the momentum of the object to help you. Learn to use tools such as a dolly to move heavy loads. And guys, as a last resort, ask for help when possible. Avoid exertion immediately after prolonged stooping. If you stay bent over for some time, the ligaments and the disc in the low back are at risk of being injured. If possible, after prolonged stooping or sitting, spend time standing before attempting strenuous exertions. The lesson is that after prolonged stooped posture or sitting, one should first stand, or even consciously extend the spine for a short period, and not go immediately into a lifting task. To summarize, try to maintain a reasonable level of fitness. Avoid prolonged sitting. Prolonged sitting is associated with disc herniations. Do not lift or bend the torso shortly after rising from bed or the seated position. Take short, frequent breaks from sitting and perform mild extension exercises. Remember to use the hip hinge and tighten the abdominal muscles before lifting and bending. Design your work to be variable. Too little activity can be as problematic as too much. Now, if your back hurts, here's a good way to try to roll over in bed. Looking at these pictures, starting from the top left picture, going clockwise, we see that while lying on one side, the person braces the torso so that the spine does not twist. The next picture shows the upper arm and leg are raised together with the lower arm and leg prying off of the floor. This is performed quickly enough to generate momentum that will carry you through the roll. You should now be resting comfortably on the other side. When getting in and out of bed, try to use this technique. Slide yourself to the edge of the bed, then try to roll on your side. Push yourself up with your arms while letting your legs off the side of the bed at the same time. And just reverse the process to try to get back into bed. I'm often asked about back belts. So quickly, here's the skinny on back belts. First, Number 1. There is no protective benefit if you've never hurt your back before. Number 2. Those who were injured while wearing a back belt sustained worse injury than if they otherwise did not wear a belt. Number 3. Belts appear to give people the perception that they can lift more, and in fact may enable them to lift more, which causes increased injury rates. Number 4. Belts appear to increase blood pressure by increasing intra-abdominal pressures. Number 5. Belts do not seem to reduce the risk of back injury. Number 6. There is only weak evidence suggesting benefit to those already injured. Number 7. Injuries increase with belt usage, probably because we get too confident in our abilities due to the belt. And last, there is weak evidence suggesting that the cost of back injuries may be higher in belt wearers because their injuries are worse. Good general exercises would include walking. To take walking up a notch, try fast walking and swinging your arms fast. This actually takes some of the pressures off of the lower back. You can bicycle, and you have the option of bicycling indoors or outdoors. Swimming is another great option. There are places that you can go to that include the YWCA, the YMCA, some PT clinics, or health clubs. But most important, please do the specific stabilization exercises that I prescribed for you. You can actually incorporate them into your warm-up for any other form of exercises. Now, I want to go over sleeping positions with you. Sometimes people are creating their own problems by the positions and the mattresses that they sleep on. So we want to make sure that you are aware of what we recommend to do and not to do. It seems that we spend anywhere between 1/3 to 1/4 of our lives sleeping, and some of us are creating our own problems. There are only 3 positions you can sleep in if you don't want to create problems: on your back, on your right side, or on your left side. If you must sleep on your tummy, I suggest getting one of these body pillows to help to reduce the pressures on the spine. I recommend 2 mattresses. Now, the Select Comfort Air mattress, also called the number bed, is probably my number 1 recommendation because it is so variable, both in how firm it can be, but also from side to side to keep your spouse happy. This mattress is available at the South Plains Mall. The other mattress I recommend is the Tempur-Pedic mattress, which is a very dense memory foam type mattress. I usually recommend people see this mattress at the Relax the Back store in Kingsgate North Shopping Center. Now, if you've been sitting down while you're watching this, let's take a break from sitting. First thing, shift to the edge of your chair. Then hip hinge to get up. Raise your arms up towards the ceiling and take a big, deep breath in. Now, while holding your arms up, try to stretch one arm up towards the ceiling at a time. Push the left hand towards the ceiling, and then bring it back down. Then push the right hand towards the ceiling, and then bring it back down. And then do that again on the left side, and then the right side. Then let both arms down and take your left arm and move it through a big circle like a windmill, and go pretty fast with it. Now, rotate the other way. Go the other way with the left arm. Do the same thing with your right arm. Go in a big circle a couple of times. A little bit faster. And then move it around in a circle just the opposite way. Very good. Okay, that's about all it takes. That's a micro break. Very good. Next. I thought you'd like that. Okay, this ends the Spine Class recovery promotion and prevention video. Now, I want you to watch the next Spine Class video called Chiropractic: Science, Art, and Philosophy. Thank you very much.